But I think it's important to see that faster results from the laboratory regarding antibiotic resistance pattern is important in the treatment of sepsis, as it has been shown that patients who get the wrong treatment actually will not survive in the same extent as other patients. In many cases, we give a very broad treatment from start, and in those cases, the patient gets the sort of right treatment, but we can, using the fast results from the susceptibility testing, you will be much faster in adjusting the treatment to a more narrow and more aimed therapy for that specific infection. And that is important because patients who get a very broad antibiotic treatment, they will suffer from side effects, might be one issue, but it could also be that the patient's normal flora is more affected by the antibiotics, and that will in the end lead us to more antibiotic resistance. Well, the case where you actually need true MIC values or very precise MIC values, I would say would be in cases where you are in doubt on what to use, what treatment to use, because of a complicated resistance pattern. Then you will be interested to actually know the MIC of the bacteria, because then you can adjust the treatment, maybe increase the dosage and do other things regarding to increase the concentration of the antibiotic in the blood or in the organ that should be treated. So that would be the main issues by having the exact MIC. But I think the most important with having an exact MIC might be that you know that the method in itself is accurate, because then you can rely on the SIR interpretation in all the other cases as well. I mean, the method in itself needs to be accurate, and then you can also use the MIC values if you want to, or in those cases where that is needed. Well, having a broad antibiotic panel is important in cases where you have a lot of antibiotic resistance. Because especially in gram-negative bacteria, you have a situation where one single antibiotic resistance mechanism is not usually the case. You are usually having several. And that means that it might be resistant to 3 or 4 or 5 different antibiotics in the same bacteria. And if you then don't get a broad panel to choose from when you have such a bacteria, then it will be much harder to treat the patient. So I think a broad panel is especially important in cases where you have high level of resistance and multi-resistance around.